Good evening. Today we will discuss about congenital rubella syndrome. Okay, this is a very important short notes and also in your NEET PG MCQ questions. So starting off with this rubella. Rubella is a single-stranded RNA virus. So first it is a single-stranded RNA virus that belongs to Tagoviridae family. It belongs to Tagoviridae family. Okay, humans are the only host for rubella. Like in measles, I said in the last video, na. So for measles, humans are the only host. So for rubella, humans are the only host. It's mode of entry. So today we are reading only congenital rubella syndrome. So mode of entry is through transplacental route. Okay, transplacental route. But this can also be spread through droplets. So since we are reading congenital today, we are reading only about the transplacental route, its pathogenesis and clinical features here. Next. So how does the defects differ from child to child depending upon the gestation age? The most important risk factor for severity. So the most important risk factor for the severity of congenital defect. For the severity of the congenital defect, it depends upon the gestation at the time of the infection. Depends upon the gestational age. Depends upon the gestational age at the time of infection. Okay. So when a mother acquires infection before 11 weeks of gestation, is associated with the severe congenital defects. So when a mother acquires infection before 11 weeks of the gestational age, 90% of the children, 90% of the baby will present with congenital defect. Okay. Next. Supposing if the defects, if the mother acquired the infection after 16 weeks of gestation, the defects are uncommon. So after 16 weeks, the defects are uncommon. Okay. So before 11 weeks of gestation, 90% of the baby present with the severe congenital defect. Otherwise, if the mother acquires infection after 16 weeks, the defects are uncommon in the child. Next, going on to the pathogenesis of rubella. So pathogenesis mainly is vascular insufficiency. This rubella leads to vascular insufficiency. Second, decreased cellular multiplication. Third, it can cause chromosomal breaks. Okay, so vascular insufficiency, decreased cellular replication and chromosomal breaks. This all will lead to tissue necrosis. This tissue necrosis causes cellular and tissue damage. So this is the pathogenesis of rubella. The most distinctive feature of rubella, which can be asked in your MCQ question and also in your viva. So the most distinctive feature of rubella is its chronicity. Okay. So the most distinctive feature of rubella is its chronicity. Okay, so because of persistence of the virus, it will lead to the tissue damage mainly in the brain. So chronicity because of persistence of the virus, because of the persistent, we suggest a ongoing tissue damage. This ongoing tissue damage is present mainly in the brain. Fine. Next, this is a pathogenesis. Next, moving on to its clinical features. You all know the triad of congenital rubella syndrome. That is sensorineural hearing loss, cataract, and then congenital heart disease. This sensorineural hearing loss This is the most common finding. Among these three, the most common finding will be sensorineural hearing loss. Next, the baby, apart from these three, the baby will be an IUGR child. Second, going off with the eyes. In eyes, the child can have two features. One in retina, other in the lens. In retina, the child will have salt and pepper retinopathy. So, child can present with salt and pepper retinopathy. Fine. This salt and pepper retinopathy is the most common ocular manifestation. This is the most common ocular manifestation. This here everything, each and every point is important in your NEET PG MCQ and also in your university Viva question. The most common ocular manifestation is salt and pepper retinopathy. But most serious eye finding, the most serious eye finding is unilateral or bilateral cataract. There can be unilateral or bilateral cataract. This is the most serious eye finding. This is about the eyes. Next, moving on to the cardiovascular system. They will present with congenital heart defect. So, what is the most common congenital heart defect in child with rubella, congenital rubella? It is PDA. Next is pulmonary artery stenosis. Among pulmonary artery stenosis, the right side will be more involved than the left. So that one you should remember. Right pulmonary artery stenosis will be more common than left pulmonary artery stenosis. This is first one. PDA is first. Second is pulmonary artery stenosis. Third will be pulmonary valve stenosis. Okay. Third will be pulmonary valve stenosis. Fine. Next, going on with its neurological defects in CNS. The child can present with common in this neurological defect is common and it will progress even after the birth also. That progression, that is progressive after birth also, that progression is called as PRP, that is progressive rubella panencephalitis. Progressive rubella panencephalitis. This will be similar to that of SSPE, that is subacute sclerosing panencephalitis, that is caused by measles virus. Progressive rubella panencephalitis is caused by rubella. Both will have the similar features. Fine. So this is about the clinical features. One is IUGR, next is about the eyes, next is about the cardiovascular system, next neurological system, and the other features. The child with this congenital rubella syndrome can have increased risk of diabetes mellitus, increased risk of hypothyroidism. Third, the child can have increased risk for glaucoma and visual abnormalities. Okay, so these are the main clinical features of this congenital rubella syndrome. Next, how you are going to diagnose? Diagnosis. One is by serological method. You have to look for IgM. Next is by viral isolation. Viral isolation by culture. Okay, where you will take sample. You have to take sample from, one is nasopharynx, one can be nasopharyngeal secretion, or other can be urine of the newborn. Third can be cord blood or the placenta. So you have to take samples from nasopharyngeal secretion or urine or cord blood or placenta, okay, to diagnose the congenital rubella syndrome. So this is about the congenital rubella syndrome. Actually, these points are more than enough for you to write in a short notes and to prepare in your Viva sessions and also for a NEET PG entrance examination. Thank you. Let's all learn pediatric together. Please like, share and subscribe our YouTube channel. Thank you.